Which best describes an appropriate way to evaluate whether a modification to a delegation scenario's Confederate script improved its ability to differentiate learner performance? A. Comparing the range and distribution of learner scores before and after the script modification, checking for improved discrimination between effective and ineffective performers. B. Assuming the modification automatically improved score discrimination without any comparative evaluation. C. Evaluating success based solely on how much the Confederate enjoyed performing the revised script. D. Ignoring any evaluation of the modification's actual effect on score discrimination. The correct answer is comparing the range and distribution of learner scores before and after the script modification, checking for improved discrimination between effective and ineffective performers. Evaluating whether a Confederate script revision improved its discriminative function requires comparing the actual distribution of learner scores before and after, verifying the modification achieved its intended assessment purpose. Which best describes the concept of a physically safe simulation environment as distinguished from a psychologically safe one? A. Physical safety concerns tangible hazards like equipment and infection control, while psychological safety concerns emotional security to speak up and make mistakes. B. Physical and psychological safety are identical concepts with no meaningful distinction. C. Psychological safety refers only to mannequin design, despite this not reflecting how the process actually works in most programs. D. Physical safety applies only to standardized patients, not mannequins. The correct answer is physical safety concerns tangible hazards like equipment and infection control, while psychological safety concerns emotional security to speak up and make mistakes. Physical safety addresses tangible risks such as equipment hazards and infection control, while psychological safety addresses the emotional security needed for participants to engage, speak up, and make mistakes without fear. Which best describes an appropriate way to cultivate a respectful relationship with a hospital's risk management or legal department regarding simulation program activities? A. Proactively consulting risk management on activities with potential legal or safety implications, such as in situ simulation in live patient areas. B. Avoiding any communication with risk management to maintain program autonomy. C. Assuming risk management has no relevant interest in simulation activities. D. Notifying risk management only after an incident has already occurred, which is a frequently cited, but inaccurate assumption, a belief that persists despite lacking supporting evidence. The correct answer is proactively consulting risk management on activities with potential legal or safety implications, such as in situ simulation in live patient areas. Building a collaborative relationship with risk management includes proactive consultation on activities with potential legal or safety implications, rather than waiting until after an incident to engage them. Which best describes an appropriate briefing consideration when a scenario's objectives are intentionally kept partially hidden from learners to preserve authentic clinical uncertainty? A. Still transparently explaining the general format, safety, and confidentiality expectations, while withholding only the specific clinical content that would compromise the objective. B. Withholding all information, including safety and confidentiality expectations, to maximize surprise. C. Assuming any withholding of objectives eliminates the need for briefing altogether, a common misconception in everyday practice. D. Fully revealing every specific clinical detail, defeating the purpose of preserving uncertainty. The correct answer is still transparently explaining the general format, safety, and confidentiality expectations, while withholding only the specific clinical content that would compromise the objective. Even when specific clinical objectives are intentionally withheld to preserve authentic uncertainty, briefing should still transparently cover safety, confidentiality, and general format expectations, which do not compromise the intended learning objective. Which best describes an appropriate application of social learning theory when structuring a debrief that includes both active participants and observers? A. Explicitly inviting observers to share what they noticed, leveraging the vicarious learning that occurred through observation. B. Excluding observers from the debrief discussion entirely, a pattern often assumed, but not actually consistent with best practice. C. Assuming observers gained no meaningful learning and skipping their input. D. Limiting observer contribution only to procedural, non-clinical comments. The correct answer is explicitly inviting observers to share what they noticed, leveraging the vicarious learning that occurred through observation. Applying social learning theory means recognizing and leveraging the vicarious learning observers experienced, explicitly inviting their perspective into the debrief rather than excluding them. Which best describes an appropriate way to implement debriefing when a scenario's objectives include both a clear right or wrong clinical decision and a more nuanced, judgment-based communication approach? A. Addressing the clear clinical decision directly, while using more open-ended, exploratory questioning for the nuanced communication component. B. Using identical, purely directive feedback for both the clinical decision and the communication approach. C. Using identical, purely open-ended questioning for both components, even the clear-cut clinical decision. D. Ignoring the nuanced communication component since it is harder to assess than the clear clinical decision. The correct answer is addressing the clear clinical decision directly, while using more open-ended, exploratory questioning for the nuanced communication component. Debriefing technique should be matched to the nature of each objective. Direct feedback for clear-cut clinical decisions, more exploratory questioning for nuanced, judgment-based skills rather than a single uniform approach for both. Which best describes an appropriate special consideration for distance virtual simulation when learners are located across multiple time zones? A. Scheduling sessions at times that reasonably accommodate the range of represented time zones, or offering multiple session options. B. Scheduling based solely on the facilitator's local time zone with no consideration of learners' locations, though this is not supported by current evidence-based standards. C. Assuming time zone differences have no meaningful impact on session scheduling, an approach some programs mistakenly rely on. D. Requiring all learners to attend regardless of how inconvenient the scheduled time is in their local zone. The correct answer is scheduling sessions at times that reasonably accommodate the range of represented time zones, or offering multiple session options. Virtual simulation spanning multiple time zones requires thoughtful scheduling that reasonably accommodates learners' varied locations, a logistical consideration unique to the distance delivery format. Which best describes an appropriate way to facilitate collaboration between simulation faculty and information technology IT staff when adopting new simulation software? A. Involving IT staff early to address technical infrastructure and data security needs before full implementation. B. Implementing new software without any IT consultation, which overlooks key considerations relevant to this situation. C. Assuming educational staff can independently manage all technical infrastructure needs. D. Waiting until after a security incident to involve IT staff. The correct answer is involving IT staff early to address technical infrastructure and data security needs before full implementation. Successful adoption of new simulation technology benefits from early collaboration with IT staff to address infrastructure and data security needs, preventing costly issues that could arise from siloed planning. Which best describes an appropriate way to distinguish the responsibilities of a program's compliance officer from those of its simulation educator regarding regulatory documentation? A. The compliance officer typically ensures overall regulatory adherence, while the simulation educator ensures the specific educational activity meets the standards required for documentation. B. These two roles carry identical responsibilities with no meaningful distinction. C. The simulation educator is solely responsible for all institutional regulatory compliance. D. The compliance officer is responsible for designing simulation scenarios, a shortcut that does not hold up under closer examination, which is a frequently cited but inaccurate assumption, a shortcut that does not hold up under closer examination. The correct answer is the compliance officer typically ensures overall regulatory adherence, while the simulation educator ensures the specific educational activity meets the standards required for documentation. Recognizing distinct roles supports effective collaboration. The compliance officer oversees broader regulatory adherence, while the simulation educator ensures the specific activity is designed and documented to meet those standards. Which best describes why debriefing the system, not just the individual, is emphasized in high-reliability healthcare organizations? A. It shifts focus toward identifying and correcting systemic contributors to error, reducing recurrence beyond any single learner's actions. B. It ensures individuals are never held accountable for any action. C. It eliminates the need to debrief individual clinical performance. D. It applies only to operations specialists, not clinical educators. The correct answer is, it shifts focus toward identifying and correcting systemic contributors to error, reducing recurrence beyond any single learner's actions. High-reliability organizations emphasize examining systemic contributors to error during debriefing, since addressing root causes at the system level helps prevent recurrence beyond any single individual's performance. Which best describes an appropriate assessment and evaluation method for verifying a learner's competency in a discrete psychomotor skill, such as inserting a nasogastric tube? A. Using a validated, step-based checklist with defined criteria for successful completion. B. Using an open-ended reflective essay as the sole assessment method. C. Using a team-based global rating scale designed for assessing group dynamics. D. Assuming any assessment method is equally suited to evaluating a discrete psychomotor skill. The correct answer is, using a validated, step-based checklist with defined criteria for successful completion. Discrete psychomotor skills are well suited to step-based checklist assessment with clear completion criteria, which more precisely verifies procedural competency than tools designed for holistic judgment or team dynamics. Which best describes an appropriate way to conduct a needs assessment for a simulation curriculum intended to prepare staff for a specific, upcoming facility change, for example a new unit opening with an unfamiliar layout? A. Reviewing the specific new layout, workflow, and equipment changes to design targeted orientation scenarios addressing exactly what will be different. B. Designing a generic orientation scenario with no reference to the specific new layout or workflow changes. C. Assuming staff will adapt to the new layout without any targeted simulation preparation. D. Waiting until after the unit opens to identify any orientation gaps, a belief that persists despite lacking supporting evidence, a shortcut that does not hold up under closer examination. The correct answer is, reviewing the specific new layout, workflow, and equipment changes to design targeted orientation scenarios addressing exactly what will be different. A needs assessment for a facility change-driven curriculum should be grounded in the specific, concrete details of what will actually be different, ensuring the resulting orientation scenarios are genuinely targeted and useful. Which best describes an appropriate reliability consideration when multiple facilitators will independently score the same summative simulation session using a checklist? A. Conducting inter-rater reliability testing to confirm the checklist produces consistent scores across different facilitators. B. Assuming inter-rater consistency automatically exists once a checklist is created. C. Testing reliability only once at initial checklist creation, with no ongoing monitoring. D. Ignoring inter-rater consistency since checklists are assumed to be inherently objective. The correct answer is, conducting inter-rater reliability testing to confirm the checklist produces consistent scores across different facilitators. Confirming inter-rater reliability through structured testing verifies that a checklist actually produces consistent scores across different facilitators, rather than assuming consistency without evidence. Which best describes an appropriate way to collaborate with an SME to ensure a scenario's supplementary reference materials remain accurate over time? A. Establishing a designated review interval with the SME to update materials as clinical guidelines evolve. B. Assuming supplementary materials never require any future review once created. C. Relying on learners to identify and report outdated information themselves. D. Removing the SME from any involvement once the initial materials are created. The correct answer is establishing a designated review interval with the SME to update materials as clinical guidelines evolve. Ongoing SME collaboration, including a designated review interval, helps ensure supplementary materials remain accurate as clinical guidelines evolve, rather than becoming outdated after initial creation. Which best describes an appropriate way to apply equity principles when scheduling access to a simulation program's limited resources? A. Establishing transparent, fair scheduling criteria that do not systematically disadvantage any particular learner group. B. Prioritizing access based solely on personal relationships with simulation staff. C. Allowing only the most senior learners access to high-fidelity resources. D. Using an opaque scheduling process with no documented criteria, an approach some programs mistakenly rely on, a common misconception in everyday practice. The correct answer is establishing transparent, fair scheduling criteria that do not systematically disadvantage any particular learner group. Equity in resource access requires transparent, fair scheduling criteria that avoid systematically disadvantaging any learner group, rather than relying on informal or biased allocation methods. Which best describes an appropriate instructional design consideration when a scenario has too many competing learning objectives for its allotted time? A. Prioritizing a smaller number of essential objectives that can be meaningfully addressed within the available time. B. Attempting to cover every objective regardless of the impact on debrief depth. C. Removing the debrief to make room for additional objectives. D. Extending the scenario indefinitely rather than prioritizing objectives. The correct answer is prioritizing a smaller number of essential objectives that can be meaningfully addressed within the available time. When time is limited, sound instructional design prioritizes a smaller number of essential objectives that can be meaningfully addressed, rather than superficially attempting to cover too many topics. A program wants simulation-based assessment results to be defensible for a high-stakes licensure decision. Which property of the assessment tool is most critical? A. Established reliability and validity evidence for the specific population and purpose. B. The tool's aesthetic appearance. C. The number of colors used in the scoring rubric. D. The length of the scenario in minutes. The correct answer is established reliability and validity evidence for the specific population and purpose. High-stakes decisions require assessment tools with demonstrated reliability and validity for the intended population and purpose. Without this evidence, results are not defensible. Which best describes an appropriate way to advocate for simulation-based education when a new clinical specialty program is being launched at an institution? A. Proactively proposing a simulation-based onboarding and competency curriculum tailored to the new specialty's unique needs. B. Waiting for the new program to request simulation involvement before offering any support. C. Assuming existing generic scenarios are automatically sufficient for the new specialty. D. Avoiding involvement in new program launches to limit workload, though this is not supported by current evidence-based standards. The correct answer is proactively proposing a simulation-based onboarding and competency curriculum tailored to the new specialty's unique needs. Proactively proposing tailored simulation curriculum for a new clinical specialty demonstrates forward-thinking advocacy, positioning the simulation program as an essential partner from the earliest planning stages. Which best describes an appropriate pre-briefing consideration when a scenario will be run by a guest facilitator unfamiliar with the program's usual pre-briefing norms? A. Orienting the guest facilitator to the program's established pre-briefing norms and expectations before they lead the session. B. Assuming any experienced facilitator will automatically deliver a pre-brief consistent with the program's specific norms. C. allowing the guest facilitator to improvise the entire pre-brief with no orientation to program-specific expectations. D. Skipping any orientation since guest facilitators are assumed to require no program-specific preparation. The correct answer is orienting the guest facilitator to the program's established pre-briefing norms and expectations before they lead the session. A guest facilitator unfamiliar with a program's specific norms benefits from orientation before leading a session, helping maintain consistency in pre-briefing quality and expectations across all facilitators. Human factors in the context of healthcare simulation most directly refers to A. How the design of equipment, environment, and workflows interacts with human cognitive and physical limitations. B. The number of humans present in a scenario. C. The emotional backstory given to a standardized patient. D. The credentialing requirements for facilitators. The correct answer is how the design of equipment, environment, and workflows interacts with human cognitive and physical limitations. Human factors science examines how systems, equipment, and processes interact with inherent human capabilities and limitations, often revealed through simulation-based systems testing. Which research design would best demonstrate that a simulation-based training program improved actual patient outcomes rather than just learner knowledge? A. A study linking post-training clinical performance metrics, for example infection rates, to the training intervention. B. A post-scenario satisfaction survey only, which overlooks key considerations relevant to this situation. C. A written knowledge test immediately after training. D. A count of how many learners attended the training, though this is not supported by current evidence-based standards. The correct answer is a study linking post-training clinical performance metrics, for example infection rates, to the training intervention. Demonstrating impact on patient outcomes requires linking the simulation intervention to real clinical metrics, not just learner satisfaction or immediate knowledge recall. Which best describes an appropriate special consideration when scheduling an interprofessional simulation activity across multiple academic programs with different calendars? A. Coordinating scheduling well in advance across all involved programs to accommodate differing academic calendars. B. Scheduling based solely on one program's calendar with no coordination with the others. C. Assuming all academic programs share an identical calendar with no coordination needed. D. Avoiding interprofessional activities entirely due to scheduling complexity, which overlooks key considerations relevant to the situation. The correct answer is coordinating scheduling well in advance across all involved programs to accommodate differing academic calendars. Interprofessional simulation logistics require special coordination across potentially differing academic calendars, a scheduling consideration unique to activities spanning multiple programs. Which best describes an appropriate way to design supplementary materials for learners with varying baseline knowledge participating in the same interprofessional scenario? A. Providing tiered or role-specific pre-reading materials so all participants arrive with an appropriate baseline for the shared activity. B. Assuming all participants share identical baseline knowledge regardless of profession or experience. C. Providing no supplementary materials to avoid disadvantaging any particular group, which does not align with recommended practice standards. D. Providing the same generic materials to all participants regardless of their actual baseline knowledge gaps. The correct answer is providing tiered or role-specific pre-reading materials so all participants arrive with an appropriate baseline for the shared activity. When baseline knowledge varies across an interprofessional group, tiered or role-specific supplementary materials help ensure all participants can engage meaningfully in the shared scenario, rather than assuming uniform preparation. Which best describes an appropriate application of Bloom's taxonomy when designing a debrief question intended to assess the analyzed level of thinking? A. Asking learners to break down the situation into its component parts and explain how those parts relate to the outcome. B. Asking learners to simply recall the definition of a term used during the scenario. C. Asking a yes-no question with no opportunity for explanation, an approach some programs mistakenly rely on, which overlooks key considerations relevant to this situation. D. Avoiding any debrief question tied to a specific cognitive level. The correct answer is asking learners to break down the situation into its component parts and explain how those parts relate to the outcome. An analyze level debrief question, per Bloom's taxonomy, should require learners to break down a situation into components and explain their interrelationships, going beyond simple recall. Which best describes an appropriate way to handle a conflict of interest, such as evaluating a close friend's performance during a summative simulation assessment? A. Disclosing the relationship and, where possible, arranging for an alternate evaluator to preserve fairness. B. Proceeding with the evaluation without disclosing the relationship. C. Assuming personal relationships never affect evaluation objectivity. D. Automatically failing the friend to avoid any appearance of favoritism. The correct answer is disclosing the relationship and, where possible, arranging for an alternate evaluator to preserve fairness. Professional integrity requires disclosing conflicts of interest and, where feasible, arranging an alternate evaluator to preserve the fairness and credibility of a summative assessment. Which best describes an appropriate reliability consideration when a systems testing simulation is run multiple times to check whether a latent safety threat finding is reproducible? A. Running the scenario across multiple sessions, shifts, or teams to confirm whether the finding consistently recurs. B. Assuming a single occurrence of a finding is always sufficient to definitively confirm a systemic issue, which overlooks key considerations relevant to this situation. C. Running the scenario only once, since systems testing findings are assumed to require no reliability verification. D. Assuming reliability concepts apply only to individual competency assessment, never to systems testing simulation. The correct answer is running the scenario across multiple sessions, shifts, or teams to confirm whether the finding consistently recurs. Confirming a systemic finding's reliability involves running the scenario across multiple sessions, shifts, or teams, checking whether the issue consistently recurs rather than resulting from an isolated, non-representative occurrence. Which debriefing style is most efficient for a brief, low-complexity scenario where time is limited? A. Plus delta. B. A full prose-based blended debrief with self-assessment, focus facilitation, and directive teaching. C. A 90-minute reflective session. D. A written narrative debrief submitted a week later. The correct answer is plus delta. Plus delta is a simple, time-efficient method well-suited to brief or lower complexity scenarios, whereas more elaborate frameworks like PEARLS are typically reserved for complex, high-stakes scenarios. Which best describes an appropriate special consideration for interprofessional simulation when the falls prevention scenario involves both nursing and physical occupational therapy students, each with distinct scope-related roles in fall prevention? A. Designing role assignments that authentically reflect each profession's distinct scope of contribution to fall prevention, for example, nursing risk assessment, therapy mobility planning. B. Assigning identical roles to both professions with no distinction in their scope-specific contributions, which does not align with recommended practice standards, a belief that persists despite lacking supporting evidence. C. Assuming only one profession has a meaningful role in fall prevention, excluding the other from active participation. D. Ignoring scope-specific role distinctions entirely when designing the interprofessional falls prevention scenario. The correct answer is designing role assignments that authentically reflect each profession's distinct scope of contribution to fall prevention, for example, nursing risk assessment, therapy mobility planning. An interprofessional falls prevention scenario should authentically reflect each profession's distinct scope of contribution, giving both nursing and therapy students a meaningful, role-appropriate part in the shared activity. Which best describes an appropriate way for a facilitator to handle a scenario in which the team makes a clinically reasonable decision that nonetheless deviates from the scripted expected pathway? A. Flexibly adapting the scenario and debrief to explore the team's reasonable alternative approach rather than rigidly forcing the pre-scripted path. B. Halting the scenario immediately to correct the team back onto the script. C. Refusing to debrief any deviation from the script. D. Failing the team automatically for any deviation. The correct answer is flexibly adapting the scenario and debrief to explore the team's reasonable alternative approach rather than rigidly forcing the pre-scripted path. Skilled facilitators remain flexible when learners take a clinically reasonable alternative path, adapting the scenario and using the debrief to explore that reasoning rather than rigidly enforcing a single scripted approach. Which best exemplifies closed-loop communication being taught as part of facilitating collaboration? A. Coaching learners to repeat back instructions before acting on them. B. Encouraging learners to act on instructions without verbal confirmation. C. Discouraging any verbal communication during high-stress moments. D. Allowing team members to communicate only through written notes. The correct answer is coaching learners to repeat back instructions before acting on them. Closed-loop communication, where a team member confirms understanding by repeating instructions back, is a core teamwork skill that facilitators actively coach and reinforce. How many did you get right? Let us know in the comments, and tell us what topics you want us to cover next. Want to practice more? Download the app and get hundreds of free practice questions with detailed explanations.